is the orally taken drug for scabies. You know scabies, which are effects like the patient come and show you these portions, okay, where scabies occurs. These occurs due to thromboculid mite. Remember, a mite that cause scabies. Thromboculid mite. Thromboculid mite cause scabies, which actually burrows inside these portions of the skin. And what is the drug of choice when we use? The drug of choice is permethrin. Remember, permethrin cream is used, right? Permethrin cream for the scabies. But what is the oral drug which we use in case of the scabies? What is the oral drug for scabies? That is ivermectin. Remember, the oral drug that we use is ivermectin. The oral drug is ivermectin. Okay. Now, drug which lowers the lipid level. Which drug that lowers the lipid level? The answer is statin. Statin decrease the lipid level. And how it decrease? It decrease by a mechanism known as HMG-CoA reductase. Statin decrease the lipid level of your body by a mechanism known as HMG-CoA reductase. HMG-CoA reductase. Next, mast cell stabilizer drug. What is the mast cell stabilizer drug? That is cromolyn. Cromolyn sodium. Mast cell stabilizer drug, cromolyn sodium. Mast cell stabilizer drug, cromolyn sodium. Antihypertensive drug which is used in pregnancy. Antihypertensive drug which is used in pregnancy. Methyl dopa. But antihypertensive drug which is prevented, which cannot be used, which is contraindicated in pregnancy, it is ACE inhibitor. Antihypertensive drug which is contraindicated in pregnancy is ACE inhibitor. Antihypertensive drug which is used or in case of the pregnant lady, that is methyl dopa. Okay. Next, drug of choice in hyperthyroidism during the pregnancy. Drug of choice for hyperthyroidism during the pregnancy. When there is hyperthyroidism in the pregnancy. Okay, let me wave this person. Okay, so many people joined. Okay. Now, what is the antihypertensive drug? Which is the drug which is used in the pregnancy in case of anti-hyperthyroidism? When the patient is suffering from hyperthyroidism and the patient is pregnant, what we use? We use propylthiouracil. Propylthiouracil, PTU, remember, propylthiouracil. Hemorrhagic cystitis. Hemorrhagic cystitis is caused by which drug? Hemorrhagic cystitis is caused by cyclophosphamide. Cyclophosphamide, hemorrhagic cystitis. To treat methotrexate toxicity. To treat methotrexate toxicity, what is the drug of choice? What is drug we use? Methotrexate toxicity. We use folinic acid. Folinic acid for treating methotrexate toxicity. Retroperitoneal fibrosis. Which drug cause retroperitoneal fibrosis? Which drug cause retroperitoneal fibrosis? It is methisargide. Methisargide cause retroperitoneal fibrosis. Okay, now what is the monitoring tool for low molecular weight heparin? What is the monitoring tool for low molecular weight heparin? How can we understand the body is having low molecular weight heparin? We can understand with a marker known as factor 10A. You have the factor 10A, that is the marker by which we can understand low molecular weight heparin. Low molecular weight heparin. Anti-TB drug which is safer in liver disease. Anti-TB drug which is safer in liver disease is ethambutol and streptomycin. Ethambutol and streptomycin. Anti-TB drug. Now you tell me, anti-TB drug which cannot be used in pregnancy is streptomycin. Which cannot be used in pregnancy is streptomycin. And which anti-TB drug is safer in liver disease? Then it is ethambutol and streptomycin. Drug of choice of cerebral malaria. What is the drug of choice of cerebral malaria? Drug of choice of cerebral malaria is quinine. Quinine is the drug of choice for cerebral malaria. What is the drug of choice of herpes zoster? Valacyclovir. Yes, it is not acyclovir. In case of herpes zoster, it is valacyclovir. Remember. What is the mechanism of action of penicillin? The mechanism of action of penicillin is it inhibits the cell wall synthesis. What is the mechanism of action of penicillin? It inhibits the cell wall synthesis. What is the drug of choice for chlamydia trachomatis? Chlamydia trachomatis. You know, the chlamydia trachomatis, the drug of choice is azithromycin. Azithromycin is the drug of choice for chlamydia trachomatis. Anti-TB drug which can cause gout. Anti-TB drug which can cause gout. What is the answer? Anti-TB drug which can cause gout is pyrazinamide. Pyrazinamide is the anti-TB drug. This actually, what does this pyrazinamide do? This pyrazinamide actually accumulates the uric acids in different joints and it produces gout. So a patient who is having TB, if you have given pyrazinamide, that person can also have gout. So always remember, anti-TB drug which can cause gout is pyrazinamide. Okay. Anti-TB combination which is safer in patient in case of hepatitis. I already told you, if a person is having liver disease, if a person is having hepatitis, if a person comes with some liver disease and the person is having TB, then you can give two important drugs of TB. You can give, that is ethambutol and streptomycin. You remember ES? Yes. So it is ES, yes, which can be given in case of hepatitis in because of this. Okay, next is mechanism of action of acetazolamide. What is the mechanism of action? Do you know what is the use of acetazolamide? Acetazolamide is used in the intraocular pressure decrease. When you are having glaucoma, there is a huge amount of intraocular pressure, and if you want to decrease the intraocular pressure, then we use acetazolamide. Now what is the work of this acetazolamide? Acetazolamide will actually reduce the aqueous formation. It will reduce the aqueous humor formation. So that is the work of the acetazolamide. What is the antidote of dicumoral poisoning? Dicumoral poisoning, we use vitamin K. Vitamin K is the antidote of the dicumoral poisoning. What is the dose of how the dose of the warfarin is managed? The dose of the warfarin is managed by INR. Next question, breast carcinoma chemotherapeutic agent. Breast carcinoma chemotherapeutic agent that can actually cause osteoporosis. So it can cause osteoporosis. That is letrozole. Letrozole can produce osteoporosis. It is a chemotherapeutic agent and that can cause osteoporosis. So which chemotherapeutic agent that can cause osteoporosis is letrozole. Okay, long acting beta adrenergic blocker. Long acting is nadolol. Nadolol is long acting. And which one is the smaller acting? It is esmolol. Which one is the smaller acting? It is esmolol. And long acting is the nadolol. Long acting beta blocker is nadolol. Treatment of severe cystic acne. Severe cystic acne you are having. What is the treatment? The treatment is isotretinoin. So what is the treatment of the severe cystic acne? It is isotretinoin. Isotretinoin. Drug of choice of trachoma. What is the drug of choice of trachoma? You know, you remember safe strategy, SAFE. That is used for trachoma. Surgery, antibiotic, facial cleanness, environmental improvement. Safe strategy, trachoma. What is the drug of choice of trachoma? Azithromycin. Drug of choice of trachoma, azithromycin, single dose a day, azithromycin. Drug contraindicated in glaucoma. Generally, drug contraindicated in glaucoma, whenever they give you this question, drug which is contraindicated in glaucoma, whenever they give you this question, then you have to answer. What is the answer? Atropine, which is contraindicated. But when the question is drug contraindicated in glaucoma patient who is suffering from bronchial asthma, then the answer is timolol. So drug contraindicated in glaucoma patient suffering from bronchial asthma is timolol.